Welcome to this month's Fit for Colorado Talk to the Doc chat. I'm CBS 4 anchor and health reporter Kathy Walsh. For the next half hour, we'll be chatting about fitness and health issues here on CBS4Denver.com. It's something we're doing on the first Tuesday of every month at 11 a.m. And throughout this chat, we're going to encourage you to ask questions by simply typing them in the chat window at right, and we will do our best to answer those questions. November is Lung Cancer Awareness Month. In today's chat, we're going to discuss lung cancer and some other chronic respiratory conditions. Joining me today is Dr. James Fenton, section chief, that is, of pulmonology at Swedish Medical Center, and Dr. Jim Hill, co-founder of America on the Move and director of the Center for Human Nutrition, UC Denver. Let's start with lung cancer. It is the leading cause of cancer deaths in the United States among both men and women. We've got a graphic of the lungs. You can take a look at that, and yeah, there you go. That points it out. Basically, you've got lung tissue problems right there, lung cancer. And Dr. Fenton, let's outline the facts about this type of cancer. I believe we have another graphic to help us with that. They're pretty frightening facts. Go ahead.
Lung cancer is very frightening. Approximately 170,000 patients are diagnosed in the United States per year with lung cancer, and 150,000 deaths occur every year, and that's essentially equal to a jumbo jet crash every day of every year. And the headline, if that did occur, made the headlines, it would be amazing. Worldwide, 1 million people die every year.
1 million.
And as you said, Kathy, it's the leading cause of cancer death in men and women. And it's more than the next 4 most common cancers combined. That's breast, colon, pancreas, and prostate. So in both men and women, often people think that breast cancer, at least in women, is the most common cause of cancer death.
Gets the most publicity, doesn't it?
And it certainly gets the most publicity and advocacy in society, but it's actually lung cancer that is the most common cause.
Smoking is the cause in 90% of cases, I read. Is that correct?
Yes. 85 to 90% of all lung cancers are associated with tobacco smoke. And therefore, that makes lung cancer one of the most preventable forms of cancers.
Wow, let's look at just how bad cigarette smoking is. I know we have a graphic of that, and it's pretty incredible. Tobacco, not nicotine, is a carcinogen. Explain that.
I think most people feel that it's the nicotine that causes the cancer, and that's actually not the case. Nicotine causes the addiction and the repeated smoking and the want to smoke, but it's actually the tars, the chemicals that are in the cigarettes that actually that are the carcinogens that cause lung cancer.
So if we didn't have any smoking, lung cancer would be a relatively rare thing.
Absolutely, and evidence for that is back earlier last century, the incidence of lung cancer really was quite low. Certainly, breast cancer was much higher in women than was lung cancer. And as the incidence of smoking increased, particularly in women, the incidence of lung cancer over the last, say, 80 years of last decade rose 600% and surpassed the incidence of breast cancer in 1987. So for the last 20 years, it's been the most common cause of lung cancer in women.
So do people not understand, and I know we have another graphic here, the benefits of quitting? I mean, it is incredible when you look at these numbers. We'll put them up here. 20 minutes after quitting, what does it say there? Heart rate and blood pressure drops?
Well, I think
20 minutes?
Exactly. You know, I think that people give excuses. Oh, I'm too old to quit, or you know, I don't want to quit, and it's not going to help me out. Well, that's not true, because even 20 minutes after quitting, the heart rate and blood pressure go down. If you 12 hours after quitting, the carbon monoxide, which is one of the toxins in smoking, decreases. And so, you know, we see benefits to the lung after a few months. They say, well, I stopped smoking for a few days and I didn't notice any difference. Well, it takes a few months for the cough, the congestion, the wheezing to get better. But it does.
Right.
And in terms of heart disease, Smoking is definitely related to heart disease. If you quit a year after quitting, your chance of heart disease, coronary heart disease, goes down by half, by 50% in just 1 year. So there is good reasons to stop smoking.
10 years after quitting, the lung cancer risk is about 30 to 50% of a current smoker.
Yeah, and we wish it would go down to zero. Unfortunately, if you've been a smoker, the risk of lung cancer never goes down to zero. But at 10 years, it's cut in, your risk of lung cancer is cut in half.
So it's never too late. You get benefits for preventing lung cancer, benefits for preventing heart disease. So no matter how long you've smoked, you still get enormous benefits from stopping.
Exactly.
How do you get that into somebody's brain? I know, Dr. Hill, all the people that you deal with say, I want to lose weight, I want to lose weight, but smoking helps me. I can't give up smoking. I'll put on 15 pounds.
So we find that teenagers are actually smoking a fair amount, and teenage girls particularly think it's a method of weight control. And I guess the message here is there are way better methods of weight control, because what you're doing is you're trading a one risk for a worse risk. So there are a lot of things you can do on the diet, the exercise side to manage weight. Smoking is not the right way to go about weight management.
How do you get people to quit?
Well, it can be very difficult. There's one of the best references might be the Colorado Quit line, and
we have that number. Why don't we put that one up? There it is. Yeah.
So this is a great a resource for people. There is a phone number, the 1-800-QUIT-NOW, or you can go online, www.coquitline.org, and there's a tremendous amount of information on helping people quit smoking.
Yeah, Dr. Hill, what do you think is successful? Have you had anybody you've been able to see? I mean, I hear of hypnosis, I hear of nicotine patches.
One of the things I wanted to ask you, Dr. Fenton, if you've tried a couple of times and failed, does that mean that you're just not going to do it, or should you keep trying?
Well, absolutely, you should keep trying. It is not uncommon for the smoker to fail on numerous occasions before actually stopping smoking, and so keep trying. It will happen. You just have to have the willpower, and also I recommend having help. I mean, there's no reason not to have help at quitting smoking. There's a number of good medications out now that can provide a benefit to those that have a particular addiction to that helps with the addiction, I guess. And there's, as I said, the website and the Quit line, and see your doctor, because they can help with this transition.
See, Kathy,